Hello warriors, welcome to this episode of Stand for AS videos. I am sure many of you must have experienced pain in the ribcage area, pain while sneezing, while taking a deep breath, and also the feeling that there is something strapped around the lower part of the chest that makes deep breathing difficult. I am sure most of you must have experienced this. Why does this happen and what best can we do for this? Let us have a look at all these points in this video. First of all, why does this happen? Let us recap what ankylosing spondylitis is all about. Ankylosing spondylitis is an autoimmune arthritis. Our own immunity starts thinking that the joints are foreign, starts attacking the joints. Which joints does it attack? The sacroiliac joints, the joints of the vertebrae, and third and the most important, the joints that these ribs make with the vertebrae. Now, what is the utility of the ribs and these joints, the joints that the ribs make with the vertebrae in our day-to-day life? It is the movement of the ribs that is responsible for the mechanical component of our respiration. The inspiration, expiration, the mechanical component is taken care of by the ribs. The ribs move up and down at the joint that they make with the vertebrae, and this is how respiration is possible. In ankylosing spondylitis, this joint, the joint that the ribs make with the vertebrae, becomes inflamed. Over a period of time, it can get fused. Once this joint is either inflamed or fused, this movement automatically becomes difficult. This is also responsible for the pain while we take a deep breath. The second component of this pain comes from inflammation of the muscles that are there in between the ribs. These are called as intercostal muscles. The site where these muscles get attached to the ribs gets inflamed. This is called as enthesitis, and this is a part and parcel of ankylosing spondylitis. So when we take a deep breath, when we sneeze, the pain that happens in ankylosing spondylitis comes from one, swelling, enthesitis of the intercostal muscles, and the inflammation or fusion of the joint that the ribs make with the vertebrae. So what best can we do? How can we manage this in a better fashion? Apart from the medicine, there are a few exercises for the intercostal muscles and the entire rib cage to keep it flexible, to avoid fusion of the joint. These are called as deep breathing exercises. I am posting a link of the video for deep breathing exercises. Do have a look at the video. Do talk to your physiotherapist and start with these exercises on a daily basis. Secondly, there is a small instrument called as incentive spirometer, which again helps with exercising these intercostal muscles and the rib cage. I am posting a link towards how to use this incentive spirometer as well. Do have a look. Get an incentive spirometer, speak to your rheumatologist and physiotherapist, and start using one immediately. With these, the exercises and the spirometer, I am sure you'll be able to take care of the pain in the ribcage area associated with ankylosing spondylitis and manage it in a much better fashion. Thank you very much for joining me, and let us meet next week. Thank you.